Thank you. That was a wonderful presentation. We shall now launch the 3 different products of Soravan range. May I request Dr. Ramesh Warrier to launch the Soravan soft gel capsules. I request Dr. Ramesh to launch each product and hand it over to our chief guest, Dr. Sri Krishna. Soravan soft gel capsules, a systemic Ayurvedic support for comprehensive psoriasis management. I request our dignitaries to kindly hold the products for a few moments so that we may capture some still photographs of this special moment. In the meantime, I request our volunteers to kindly distribute the Soravan samples to all our doctors. A Soravan photo booth also has been arranged on the ground floor. All of you can make full use of that. Please hold the products for a few moments so that we can capture this moment. Wonderful. Thank you so much. You may please take your seat. I now request Dr. Ramesh Warrier to introduce our new QR code system that we have implemented on all our products starting from Soravan range.
Good morning, everyone. I have great pleasure to introduce a new concept we are bringing into our products with effect from today. Soravan is the first product where we are going to have a QR code here on every pack. From now on, all new products of AVN will have a QR code here and customers can scan that. It will have the details of the heavy metal analysis which we are doing. So one of the biggest concerns we are encountering from the industry and from the entire global healthcare fraternity is the fear about contamination with heavy metals. So we thought it's one of our most important responsibilities to show that Ayurvedic medicines are absolutely safe without the fear of heavy metals. So in that effort at AVN, we have now introduced this concept that all products henceforth will be tested. Every batch of each product will be tested and it will carry a QR code which the customer can directly scan and get the certificate of analysis. It is done with the most sophisticated international standard equipment, So it is being done with the international standard, which is ICP OES. So for heavy metal testing, that is the global standard, the most precision equipment which can detect things from parts per billion. Whereas, so we are testing every product, and so Soravan, the entire group, is coming with a QR code. So the capsule, so all internal products will carry the QR code. So that is our this thing, because external don't require that safety at the moment. So we are thinking of having all our internal products with this stamping. So over to you. Thank you.
Thank you so much, sir. With this, the launch of Soravan is complete. We now move on to the academic highlight of the day, the scientific session. Okay, before that, he will show you the QR code scanning system.
So the idea is such that you have this QR code, you just scan the code, you get the link here, so you open it, and here you have the certificate of analysis here. So all the heavy metal analysis here. This says cadmium, not the result is below detectable limits, lead below detectable limits, mercury below detectable limits, and arsenic below detectable limits, while the limit that is not more than 0.3 milligrams per liter. The next one is not more than, which is lead is to be less than 10. Our detection level is 0.05. Okay, and the product is shown to be less than detectable limits. So mercury has got not more than 1 unit, and our equipment is capable of detecting 0.01 unit also, and it is below detectable limits. And arsenic is not more than 3, whereas the detectable limit for our equipment is 0.05, and this is below detectable limits. So like this, the customers can directly see the heavy metal safety. So that's the new feature we are launching with Soravan today. Thank you.
Thank you, Doctor, for that. So once again, now the Soravan launch is complete. We now move on to the academic highlight of the day, the scientific session. This scientific session will begin with Dr. Ramesh Arvaryar enlightening us about Soravan and the thoughts behind this product. May I invite Doctor.
Okay, anyway, go ahead. We'll just wait for a minute for the projector to come on, and we'll start the session. So, at the outset, I'm just going to be introducing the product Soravan, the thought behind this, the rationale behind and the validations that we have done before this launch. I would like to tell you that any product launched by AVN is created, used in our clinics and hospital for at least about 3-4 years before it is launched into the market. Any product of AVN, that's the way it is done. And even before that, all products are actually derived from our clinical insight. Fundamental origin is the clinical experience that we have been having over the past 3 generations, modified to modern, using certain modern technology in order to augment the efficacy. So for example, if you are doing a combination of certain products which have been giving a certain level of efficacy, we do some specific work on bringing it together into a single product. The idea is, when we are giving, like Dr. Ramesh was speaking in the morning, when we are giving them a range of products to consume, we see that the compliance is very low. Most patients don't take the product regularly, which is what is very important for most of the disease where we come into as a very important treatment protocol. So people need to be taking the medicine, only then they will get the results. So our concept is how can we augment that compliance? How can we help people continue their treatment and get the full benefit of the therapy? So that's why we are combining the classical formulae that we have been using very effectively over the last 3 generations for specific diseases, doing a lot of pharmaceutical related work on how do we potentiate it and concentrate it in such a manner that we can give it in a small dosage form. And then that product is used. The new version of the classical formula is used in our hospitals for at least 4 or 5 years before it becomes a product that is launched into the market. For some of the products, we have been able to identify good models to validate how the product is working as well. For many, there are still not good models which match the reality of what we want, but wherever that is possible, we are now also trying to use the models to see how the products are working. Soraven, I'm happy to inform, is one such product where we have been able to do that. We have been able to validate how the product has been working as well. So those are the topics I'll be covering. So now that this is ready, I'll go into the main presentation. Of course, I'm not doing the primary CME. Our main speaker of the day, Dr. Srikrishnan, is here to do the full-fledged CME on psoriasis. But my task here is to launch Soraven to you in a manner that can be understood by everyone. So here we have our wonderful new baby today, in that sense, Soraven, which is available now in 3 forms: capsule, oil and ointment. We are also going to be coming out with a shampoo and a soap version as well. That will come after some time. But today we are actually launching these 3 dosage forms of Soraven. So what is Soraven meant to be? It's a complete evidence-backed Ayurvedic range. It's a kit. It's a comprehensive kit for psoriasis management. And psoriasis, as we all know from our classical description, it comes under Kushta. So what is the problem we have set out to solve? So what is the burden of this disease, psoriasis? 2 to 3% of the global population is supposed to be suffering from psoriasis at any given point of time. And this is the US estimate, is that about, of course, unfortunately in India we don't have too much statistics. So in the US population it is present to the extent of about 125 million in the US population alone. Imagine we are at least 5 times the size of US. And I don't know what is the percentage of incidence. So you can imagine the number of people who are suffering from this disease. In India, 0.44 to 2.8% of the population is supposed to be suffering. And it is 2x more common in men than in women. As we know, certain diseases have a genetic predisposition. And psoriasis, we very often look at it as a skin problem. But fact is, it's much beyond that, which is what I think is the main positioning that we are trying to say, that psoriasis is not just skin deep. It's far more intense than just a skin disease. It's a lifelong relapsing condition, a chronic disease with no definitive cure. The realistic goal is durable control. So when we say cure, very often it is confusing, because from a patient point of view, what he looks at is as cure is if I have a problem and I get all those problems are gone and I'm back to normal, for a patient it is considered cure. But as technical people, we are actually, from modern scientific definitions, we are prohibited from saying that it is a cure. Today we know it is a remission. It becomes silent, the patient becomes free of symptoms, he can remain so for different lengths of time, but it doesn't mean he is completely cured, because it can always relapse. Because we know the underlying mechanism as well. We know that the immune system is such that once it develops a specific action against a particular disease modality, the body keeps that memory forever in life through a system called memory cells. So the lymphocytes, which are specifically specialized to create a particular antibody sequence through an autoimmune reaction, body has to undergo a lot of chemical synthesis in order to create that new version of that white blood cell. And so the body doesn't want to go through that trouble all over again, which is why vaccines work in the first place. So our body stores that memory of having created a particular antibody. And so, even for an autoimmune condition, it's a similar thing, that the body's immune system is now holding a memory of that immune attack that it has already made once. So this memory stays forever, thereby it leads to a recurrence of the condition whenever there is a trigger. So that is why technically it is wrong for us to say it's a cure. So very often I think we need to explain that to our patients also. But from a patient's point of view it is a cure. But technically that's why we are prohibited from claiming that it is a cure. So our product meets that definition in the sense that it helps relieve or completely bring the patient who is in a stage of psoriasis into full remission. But we don't want to call it a cure. So it has got a very severe impact on the quality of life, because as a prevalence and the deterioration in quality of life because of psoriasis, we are not saying it is as severe as a heart disease or a diabetes or a depression, but the impact it leaves on the life or the quality of life of the patient is comparable with all this. Of course, I am not saying that, this is what literature talks about. And it's not only skin deep, it is associated, about 30% of patients suffering from psoriasis are likely to become patients of psoriatic arthritis as well. And people who are suffering from psoriasis also have a higher cardiometabolic risk, making early sustained control extremely important. So the two elements in this, how can we bring in early remission? Number two, how can we create sustained remission? So these are the two objectives that we are trying to achieve through the product. I'm sure I don't need to introduce, but just because it's a thing about psoriasis, I'm just introducing psoriasis. So we all know, it's very familiar, the clinical plaque that is associated. The same plaque in the cross section is what we are seeing here. It is not just at the epidermis level. The same plaque in a cross section, you can see it is actually going into the deeper layers of the skin as well. And the typical manifestation is the silvery white scales on well demarcated red inflamed skin. So there is a region of erythema around the lesion. A thickened epidermis, thick scale and a dilated dermal vessels are the characteristic manifestation of psoriasis. So I'll very briefly touch upon how we understand psoriasis from the Ayurvedic point of view. I'm sure Dr. Srikrishnan would be doing a very elaborate aspect of taking it that side. So I'm just touching it and going. We all understand that psoriasis is primarily understood to be a Vata Kaphaja Kushta. So the different categories under that, we all know the 20 Kushtas, Vatayana Kushtam, Kapalam, Pitta, Daudumbaram, Kaphat, etc. So, Charma Eka Kushta Kidibha, Siddhma, Alasaka Vipadikaha, Vata Shleshnodbanaha. So those Vata Kapha predominant diseases are the ones which carry the characteristic manifestations of psoriasis. There are people who call it Eka Kushta, there are people who call it Kidibha, there are people who call it Siddhma. Vipadika is also very clearly understood to be a part of psoriasis today. We call it as palmoplantar psoriasis and so on. So the different the types of manifestations of psoriasis actually encompass the whole spectrum of the Vata Kapha spectrum of Kushta. So Vata, we all know, characterizes the dryness, scaling, fissuring, itching, etc. Of course, itching is predominantly a Kapha phenomenon, whereas Kapha also denotes the thickening, the induration or the thick feeling on the skin. Because I think from an Ayurvedic point of view, especially with respect to skin diseases, the suggestion is to look at the dosha bhediya vihidaihi. Adished linga karma vihi doshe kushteshu dosholpanatam. So how do you find the dosha in a kushta? It is through going back to the dosha bhediyam. And that is the fundamental characteristic manifestations of the doshas are what we use to identify the dosha predominance in any kushta. So here predominantly the disease being Vata Kaphaja, there are conditions where there is a Pitta Anubandha, but primarily it is a Vata Kaphaja disease. We all know that all diseases have an element of all three doshas, but we know that it is a predominantly Vata Kaphaja Kushta. From a modern point of view, it's a chronic immune-driven inflammation that makes skin cells multiply far too fast. So our skin cells are getting dead and they are removed automatically, and the new cells are also forming. Only thing is, in the case of psoriasis, the rate at which the new cell is getting formed becomes very fast. And that is the real challenge. It's the same disease we are talking about or understanding it from two languages. So it begins as an immune misfire. For a long time, psoriasis was regarded as a disorder of the skin surface. Modern research shows it is deeper than that. It's an immune-mediated disease in which the disease-own defense cells switch on inside the skin and do not properly switch off. So as we know, the death and growth of skin is happening, but here the rate of growth is actually becoming too fast. It builds up in a few steps, and it is not happening, it's not one phenomenon that's happening. There is a trigger. Unfortunately, we know of certain things. Of course, there is a genetic vulnerability which undermines the risk of developing psoriasis, but it doesn't explain the entire incidence of psoriasis. Certain genes create a tendency or a trigger. There are other triggers, factors on top of this genetic vulnerability, like stress, a throat infection, an injury to the skin, even some medicines can set this immune system in process. So this immune reaction is starting off as an immune trigger, which is happening at one point of time, which then moves into the next stage, which is where the sentinel cells sound a false alarm. The skin's watchguard. See, we have a part of the immune system very strongly protecting us because the skin is the area where we are exposed to the external surface. So every area of the body where we are exposed to the external milieu is protected heavily. And the skin is one such tissue which has got the dendritic cells present in the subepidermal areas, as a watchguard. So these dendritic cells misread the trigger as a threat, and they release a signaling molecule called interleukin 23. So the dendritic cells are triggering the release of cytokines called interleukin 23. So this is the starting of the whole problem. So in response to any stress that is happening, not just the mental stress, but also physical stress, UV rays can be a trigger, and several other factors like viral infections, as we said. So it triggers the release of interleukin 23, and then the inflammatory T cells switch on. So when these cytokines are secreted, more of the immune system, it's like triggering and saying that there is a problem here, please come. The entire immune system rushes to that area. Interleukin 23 activates a type of white cells, the Th17 cells. So that's a type of the T lymphocyte, which floods the skin with inflammatory messengers. So it's like body is thinking there is an infection that has happened. Some foreign body has entered into it, and it wants to extinguish it. In that effort, the body sends a real plethora of other cytokines coming in. In this case, particularly, interleukin 17, interleukin 22, and TNF alpha are the three chemical mediators that are predominantly getting triggered by this Th17 cell, which in turn is triggered by the interleukin 23 released by dendritic cells. So the key shift in understanding which is happening of late is what has also enabled us to understand the disease in a more molecular level from the modern scientific point of view, though we had the understanding very clearly from a traditional Ayurvedic point of view. The key shift in understanding is that the disease starts in the immune system, not on the skin surface, which is why removing the scales or moisturizing alone is not going to be a solution. It has to be addressed at a systemic level. How that becomes the plaque that you see. So the disease in modern terms from inflammation to plaque. Now this inflammation has started. There is a lot of cytokines that are getting flooded in that area. Now how does that become a plaque? The skin cells over multiply. Those messengers order the skin cells, which is the keratinocytes, into overdrive, renewing in 3 to 5 days instead of 28 days. Normally, the skin death and the generation of the new cells happening in 28 days now becomes a cycle of 3 to 5 days. The immature cells reach the surface too soon and pile up as silvery scale. So the entire scaling is a result of this overdrive that is happening in the keratinocytes as a result of the effect of these immunocytokines. Then what happens when this whole active inflammation is going on? Normally, then the body starts increasing the blood flow to that area by increasing the blood vascularity. So angiogenesis, it's what is called. New widened blood cells feed the inflammation, giving the redness. The epidermis itself thickens, giving the raised, well-defined plaque. So this hyperkeratinocyte proliferation is what gives the plaque. And the inflammation and the angiogenesis is what produces the pitta anubandha, as we call it. That is not uniformly present in all conditions, whereas in some it is there. And it becomes a self-feeding loop. The stressed skin cells send fresh alarm signals back to the immune cells, so the inflammation sustains itself. A chronic relapsing disease that may also involve the joints and metabolism. So I think I said I will not be speaking much about it, but I myself realize I'm going too much into the disease. Maybe I'll rush this. Yeah. So now let us see what was the understanding. So, I mean, this was not the way in which we understood the product. Okay, now I'm primarily coming from a space of how did we create the product. So that was not from this understanding. Let me be very clear. It was based on clinical insight, based on traditional Ayurveda. My father was an expert at skin conditions. And in fact, he has written a paper for a seminar at Kottakkal called Ega Kushta. He called it as Ega Kushta, and there is a big paper he has written. He was an expert at treating skin diseases and gastrointestinal diseases. Of course, he would treat the entire spectrum. But these were some of his highlights. He was extremely successful in treating patients with psoriasis and all that. And his combinations, the traditional understanding of what medicines in our classical literature are appropriate during different stages of the disease, is what has led to the discovery of the product. First, they said we will do a clinical trial. And when the clinical trial was done, the protocol was there was a control group where they would clean the foot and apply Vaseline. There was another group where the foot will be cleaned similarly and the ointment would be applied. Fantastic results for the product. Fantastic results for Vaseline as well. Okay? So what does that show? Maybe it is that care and just applying the Vaseline, blocking this thing was enough to heal the crack in that particular type of condition where that ointment was being indicated. So we wanted to know, is that what is happening? So we don't want to be, selling across a bluff. Okay? It's okay. Even if you heal it with Vaseline, it's okay. But we don't want to be peddling Vaseline in the name of Ayurveda. We said it must be doing something more than that. So that is the way in which we have tried to evaluate Soraven. So it's not that we designed Soraven looking at interleukin 17 and 23 and the whole cascade, and it will keep changing also. Today we know so much, after some time they'll say few other cytokines are involved. So we are not going by that. We are just using it to strengthen our positioning of the product as a real thing that is working on the root cause of the disease rather than just addressing the symptoms. So what is giving us this thing? So it was fundamentally based on my father's clinical insight of the 3 products he would use very, very effectively in the management of psoriasis. I'm not saying he used to use only these 3, several products. I mean, our treatment is very personalized. We all know that. The ideal Ayurvedic treatment is extremely personalized. So that is the absolute. Keeping that in mind, still we need a base. We are not sort of personalizing. I'm sure most of us who are practicing are not giving one prescription, one unique prescription for every patient that we see. We are generalizing. We are categorizing people into some buckets. So even in Ashtanga Hridaya, the protocol talks about Vataja, Pittaja, Kaphaja or whatever, for any disease for that matter. And so it's a bucket. It's again not for one person. It is again, so there is a protocol that can be given for a category. So it is in that spirit that we have come out with Soraven for psoriasis. So which is the broadest spectrum of products? Now, the products which can address the broadest spectrum of patients suffering from psoriasis, that has been the idea behind devising Soraven. So like with any disease, it's not that, especially with respect to skin, it is not that Soraven will alone be the absolute solution. No, we are not claiming that. We all know there is much more to a disease and there is a personal factor that comes into play. So when you are talking about extremely severe cases of psoriasis, for example, we definitely understand the need for Panchakarma, for a Shodhana Chikitsa as a foundation for treatment of any Kushta. See, our Kushta Chikitsa itself starts with saying, Kushchinam Snehapanena Sarvam Purvam Upajare. So we are not saying Soraven is superior to that. No, never. So where that can be done, that is the best. But it is not that we are able to do that continuously all the time. We are definitely, after a course of Shodhana also, there is a Shamana Chikitsa, which is what is the enduring thing. And in many cases which are mild, neither the patient is ready nor do we even indicate a Panchakarma as the first intervention. So it is in that slot that we really designed Soraven. So we said, if there is a product that can address the largest base of people who are suffering from psoriasis, without causing trouble, especially in the case of skin disease. If our dosha nirnaya is wrong, the product will aggravate the condition. So we were very careful in designing Soraven in such a manner that a large section of the patients will benefit and not have a problem. So I can very confidently say that Soraven capsule, from our experience, has been fulfilling that particular criteria. We have never seen a sort of an aggravation unless you are totally wrong. It's a total pitta predominant condition, and then we are thinking about it, oh kushta, this is vata kapha kushta, and you are completely neglecting the pitta, you can still have a challenge. But I think as doctors we will easily pick that extremely high level pitta. But if there is a slight pitta anubandha, moderate level pitta anubandha, we will not go wrong. That is the extent to which we have beautifully fine-tuned Soraven. So primary product, which is the core of this product, is Aragvadhadi Grida. So Aragvadhadi Grida is what we use here. So the classical Kushtagna drugs of Aragvadha, Nimba, Guggulu, Manjishta are all being understood in the classical scenario, and they all act on the, today we know that from modern chemistry, we know that these herbs have got active components which are working on these sort of cytokines. So this forms another validation of how Soraven could be working. So what should the treatment do? That was our whole idea. It has to calm the disease at the root. So any disease, any treatment which needs to be effective in psoriasis for the long term has to address the root cause, which is interleukin 23 to the interleukin 17 to the TNF alpha axis. That axis has to be blocked. It has to act at several points at once. So, and it also has to be gentle and safe for long-term use. And it has to also start internally and also address the external situation. So this was the idea behind the design of Soraven. So we said how Soraven was built, a polyherbal shamana that calms the same axis. Many actives working together not on one target but on all the different molecular targets which are today understood to be contributing to the disease. It's a concentrated, well-tolerated shamana for daily use. And we also need to have the inside and outside approach, which is why we are coming out with this whole set. You need a capsule to address the internal pathophysiology. You also need external therapies like oil and ointment. I will come to that, why we need the two different forms. So we created this one system, Soraven. The internal core is Soraven capsules, which is for oral. It addresses the systemic autoimmune condition that triggers the disease process, which is at the core of the protocol. On top of that, for the external management, we have this oil which is there for the scalp and for widespread lesions. So you can't generally, if it's a small scar, it's a small lesion somewhere, you can apply an ointment. But if it is like widespread all over the body, you will find it extremely difficult. So we said you need to have an oil. Especially for scalp use, you will need an oil. And where the entire body is affected, also you will need an oil. And when you have extremely thickened plaques, you will need to use an ointment. We find that the ointment is much more effective in blocking that cracks. It is effective in giving the effect on the thickening. Though the ingredients of the oil and the ointment are more or less similar, there is some slight modification, again, to address that pitta a little bit more with respect to the oil. So if you are a little bit more concerned about pitta, oil is a better option. But directly, very strong vata kapha, still with some protection for pitta, ointment is the medicine. I'm not still saying that it will completely take care of pitta. If there is too much pitta, you still have to be careful. You will have to add something else which is more pitta-hara. But by and large, because if you make it totally nirvirya, then nothing will work. So you need to have enough amount of virya left as well. So we have positioned it in that axis. So what is the patient product fit? The systemic recurrent multiple sites patient, everybody needs the capsule as the core. If it is only a small lesion, then scalp and widespread areas, you need the oil and capsule. If it is a few thick localized plaques, maybe the ointment and capsule. If it is very less, very small area only, maybe you can even start with the ointment. If it is just one lesion somewhere, you can even probably, but you know that you are not addressing the root cause. With just the ointment, you are only addressing the peripheral immune thing that is happening there. You need to have a systemic intervention for long-term prevention. So for most patients, you will need a capsule as a base,
and a topical application of choice. So why Soraven is different? There are three classics are combined into this. I'll come to that. I think I'll go into that. We have also done preclinical work at the CSIR accredited IICT, which is the Indian Institute of Chemical Technology. It's a country renowned institute where we did the study evaluating Soraven. And incidentally, even our R&D is a DSIR accredited R&D facility here. So these three classics, now we will look at the capsule in more detail. It is basically Aragvadadi Ghritam, the medicated ghee which is anti-kushta, Vata Kapha. We all know that Aragvadadi is for Vata Kapha related conditions, and this is the foundational thing. The next drug is Kaishora Guglu, which goes into that, and we also have Panchanimbadi Guliga, as I mentioned earlier. So all these are unified into a concentrated soft gel. Goes into one capsule. So if you are recommending 2 capsules of Soraven, you are actually giving 10 grams of Aragvadadi Ghritam. So we recommend that to be given 2 to 3 times, generally twice a day, but if it's a very severe case, you can go up to 3 times a day. So you are giving between 20 to 30 grams of Aragvadadi Ghritam in a highly concentrated form. That is one component. The other component is where we include the components of Kaishora Guglu and Panchanimbadi again into this formula. So that is the design of the product Soraven. Again, making the dosage very convenient. So why it matters in the clinic, like Dr. Ramesh was saying in the morning, asking them to take all this becomes a big challenge. So 2 capsules versus spoonfuls of ghee, 2 to 3 times a day. You can imagine the compliance, how regularly a patient is likely to take that. And number 2, the bitterness and all the different things. Of course, today we are also very scared about giving Ghrita because there is overall everybody is scared about weight gain, cholesterol, heart disease. This becomes the big fear also. Here, your amount of Ghrita becomes very less. The medicinal content of the Ghrita is preserved nevertheless. Third thing is tolerability. It avoids the excess heating and so on. It's gentle for continuous use and extremely efficient at delivering the lipid-soluble actives. It's standardized and quality assured. So consistent fingerprinting, we have done HPTLC fingerprinting of the product in our DSIR accredited R&D lab. And you know about the quality discipline that we are bringing in. Every product is tested for heavy metal safety. So how does Soraven work? Across the entire spectrum. From the dendritic cells producing interleukin-23, which is addressed by the andrographoloids and nimboloids. The Th17 activation, which leads to the interleukin-17A to 22 and TNF-alpha, that is addressed by the camphorol or gugulsterones that are present. The TNF-alpha, NF-kappa B and TNF-alpha interleukin-6 cytokine is addressed by plumbagin from Chitraga. The keratinocytes proliferation and TREG are addressed by plumbagin, berberin and camphorol. Okay, again as I said, this is not how, we are not isolating the active principle. It is traditional Ayurvedic principle again. We are not just adding these active compounds and creating the product here. So all these different mechanisms go into the effect of this product. So as you can see, it is addressing all the different points where the disease is actually getting triggered. So when Soraven down-regulates interleukin-23, 17 and TNF-alpha, the inflammation and the itching subside. Keratinocyte hyperproliferation, when it is addressed, the plaques become thin and soft. The scaling and barrier disruption is blocked by less scaling and flaking. When you do that, there is less scaling and flaking. When VEGF and angiogenesis is blocked by the drug, the redness fades. And the TREG imbalance is again, when that is addressed, it becomes a calmer skin for the long term. Of all these actions, the least action of Soraven is in the angiogenesis. As I said, it is not designed as a Pitta Viruddha drug. It is designed as a Vata Kapha Viruddha drug. with taking care of pitta to some extent. So that is the only main thing I want to highlight to all of you. Sorry. So how do we put it to the test? Now that we have created this product with the design, what we did was to give only the capsule to animals. You know, there is a standard model called imiquimod induced psoriasis model in a specific genetic mice called BALB-C mice. So these mice, when they are injected with imiquimod, they develop psoriasis-like lesions on the skin. So we were trying to see that we divided this thing into different groups. One group was the normal control where nothing was done. They were just normal rats with this genetic specification. Second group, imiquimod was only administered, so they developed full-fledged disease. The third group where imiquimod was administered and a vehicle. It's like the sham control. And then we had a standard, which is dexamethasone. Modern medicine, the standard is to use steroids. So we gave dexamethasone to one group. Then we gave soraven at a low dose to one group and at the higher dose to the other group. So these were the 6 groups that we used to study the product. Sorry. So at the end of the study, they reported that these are the 6 groups. So the first group is on day 1. So just the new rats, when they were just injected with imiquimod, before they were, that first day is when the injection was given. In the first group, nothing was given, but you can see on day 7 what is happening. The only disease model is completely full of scales and full-fledged psoriatic lesion. The next one is the vehicle, which is also bad, but it actually looks that the vehicle also has done something there. So this is what we need to avoid. If our product is only showing as much as the vehicle, that means it's not doing anything much. You must have definitely something more. So maybe the rat also has a placebo effect of just giving some injection also, or is also giving some sort of a reduction compared to the model which did not have anything. The next model is where dexamethasone was given, and the next is where the low dose of soraven was given, and the last one is where the optimal dose of soraven was given. So at the different doses, you can see this is only one of the areas which were looked at, which is the photography itself. Then we went into a very detailed analysis of all the different things. So we used the PASI scale, which is the internationally accepted scale for measuring the extent of psoriasis. So PASI scale, the diseased group or the imiquimod group had a rating of 5.2, whereas within 7 days with soraven, it came down to 4.2. Dexamethasone obviously had a more profound effect than this. It came to 3.4. But we found that there was statistically significant, that is p-value of 0.01. To that effect, there was a statistically significant clinical reduction in the disease with respect to the PASI score. The scaling score is another metric which we were used. On day 6, it was measured. So 2.9 was the level of the diseased group, where it came down to 1.7, as equal as dexamethasone with respect to the scaling. The statistical significance was 0.0001. And erythema score, actually it was 2.8. In the disease control, it came down to 2.6 in our soraven group and 1.9 in the dexamethasone group, which is what I was saying, that our product is primarily not the best at addressing the erythema. It is not a pitta-hara drug. The ear thickness, which is a clear manifestation of the vata-kapha aspect of the disease, 60% of the ear was, the thickening was about 60%, it came down to 42, even better than dexamethasone. So that was the observation we had. Again, a p-value less than 0.05, which was the cutoff that we had decided for statistical significance. Then we also looked at the cytokines. What is happening to the cytokines? Not just the external manifestation and external parameters. We looked at all the cytokines, what is happening. So from the healthy subject, which was 660, the diseased interleukin 17 went to 2,600. It came down to 710 with soraven. Again, statistically significant. One of the top selling or the latest drugs in modern medicine is actually addressing this target of interleukin 17. I don't even know if this drug is here available in India as yet. I think it's only abroad. It's a new, very, very new sort of monoclonal antibody which is addressing the interleukin 17. But we find that our product is really able to bring down the level of interleukin 17 beautifully. Interleukin 23, which went up to 1,240, came down to 810 within 7 days. at a statistical significance of 0.01. TNF alpha, which went from 285 to 412, came down to 318, again at a significance of less than 0.05. Interferon gamma went up from 66 to 150, came down to 53 with a p-value of 0.001. Interleukin 1b went from 900 to 7,100. It came down to 4,100 at a statistical significance of 0.05. And IL-6 from 65 to 450 came down to 120 with a p-value of 0.01. So as you can see, the top three are actually targets for modern monoclonal antibodies. Most commonly, what is used in modern medicine is this adalimumab, which is a TNF alpha blocker. It is used in arthritis and other conditions also, because TNF alpha is a common pathway which is involved in that inflammation. So we are finding that our drug is having an effect even similar to that monoclonal antibody. I wouldn't claim it is equivalent, but it is definitely having an effect on the immune markers. So it calms the right signal. From these studies, we are able to see that it has been able to address all those cytokines which are involved in the disease production and propagation. For paucity of time, I would like to rush through because I think I'm already overshooting. The tissue architecture, histopathology was done, which again showed that there was very, very significant reduction of hyperkeratosis, epidermic hyperplasia, parakeratosis, and rete ridge elongation. On all these parameters, statistically significant reduction happened from the deceased to the Soraven control group. High safety margin, we also did a full-fledged acute oral toxicity as per the OECD 425 guidelines. There was no mortality, no adverse clinical effects, no organ abnormality. So all organs were, put under histopathology to see if there was anything. It was consistent with the formulation designed for gentle long-term use. Sorry. Hey, it's going back. Hey. Okay, right. Fine. So now we come to we saw the high safety margin. Then coming to Soraven oil, it is basically based on Dantapala Keram along with Dinesha Vilyadi and Eladi Kerams. I'm not saying the entire thing is added, but we have selected those elements from that, and that is what inspires this product of Soraven oil. It's a combination of these three oils. So it very clearly helps in the plaque reduction. It is refined for daily use. The classical potent Siddhmagna Thailam. So we have this Dantapala Thailam by the name Siddhmagna Thailam in our case, along with this thing. So that is actually sometimes it can trigger Pitta very strongly. So we have sort of mellowed it down by addition of Dinesha Vilyadi and Eladi to make it more suitable for a larger range of patients. But of course, as an oil, you can even mix it with some other Pittahara oil if you think it is relevant. I think Dr. Srikrishnan was sharing that insight with me, how incidentally he also uses this combination. Anyway, I'm sure he will be talking about it later. Then we come to the ointment. As I said, the ointment is again based on the same thing with a better occlusion. So where there is a bigger element of scaling, the ointment is a better choice compared to the oil. Whereas if you think there is a slight pitta, then the oil is a better combination than this. And oil you can still manipulate because you can add other oils to make it ideal to your particular patient's requirement. So that is why the design of all the three products. So using the range, it's very evident now that Soraven capsules is the main Shamana. In very severe widespread disease, combine it with Shodhana. We also say that the best is Shodhana Chikitsa with Uttama Matra Snehavana, but as a Shamana, as well as in cases who are not ready for or do not need a Shodhana, Soraven capsules have been designed for that. And choose the topical based on the site and your dosha, vikalpa that you do in the particular patient. So we have the evidence and the experience backing this product. As Soraven itself, we have been using it for 6 years in our clinics and hospital with great effect. So why Soraven? The classical authenticity, it is backed by authenticity of the classical formulae, and the concentration potency is what we bring as a very, very unique offering in this product. Our own preclinical evidence which is again validated, tested at the DSIR. Sorry, we have clinical evidence, not in the form of a controlled study, but more like, open label studies, but preclinical controlled study done at IICT Hyderabad. So the take-home message is Soraven is a standalone curative intent core, reserves Shodhana for the most severe whole body disease where it remains essential. So I'm not claiming that Soraven is a substitute to Shodhana Chikitsa, but it can enhance the effect thereafter as well as for those who are not ready or don't need Shodhana Chikitsa. So the capsule plus topical is what we recommend, matched to the patient's requirement. Counsel trigger avoidance. It's very important for them to identify and avoid triggers in order to prevent remission. In order to prevent a relapse. To sustain the remission for longer. A classical system, standardized and evidence-based. So that is what I want to offer to all of you friends. Thank you very much for the patient hearing. I'll take questions and answers, but after we are done with Dr. Sri Krishnan's presentation. Thank you one and all.
Thank you, Dr. Ramesh, for sharing the vision and the study behind the birth of Soraven. Continuing with the scientific focus, we now move on to the important clinical session on psoriasis, bringing together practical insights, integrative management approaches, and treatment experience. This session will be led by Dr. Sri Krishnan, whose experience in Ayurvedic dermatology makes this a valuable learning opportunity for all of us. Before inviting him for the session, allow me to briefly mention a few important aspects of his distinguished academic and clinical journey. He passed BAMS with first rank in 1981 from Ayurveda College, Kottakkal, and completed his MD Ayurveda in Kaya Chikitsa with special focus on Visha from the Postgraduate Institute, Trivandrum. Dr. Sri Krishnan is empaneled as the Chikitsa Guru by Rashtriya Ayurveda Vidyapeeth, the National Academy of Ayurveda, an autonomous body under the Ministry of Ayush, Government of India. He has presented several scientific papers in national and international seminars and has contributed to various journals. He delivered a 2-hour lecture on Ayurveda dermatology at the 6th International Ayurveda Symposium in Belgium as a guest speaker in September 2017. He has also delivered a lecture for the Ayurveda Yoga Organization at Hiroshima, Japan on atopic dermatitis in March 2018. Dr. Sri Krishnan has received many awards and recognitions. Font.
Aditya Doctor, Zoom.
a small issue with the PPT. It is getting corrected now. A Soravan photo booth is arranged on the ground floor. Whenever you're free after the session, all of you can go and take photos, make use of the... Yes, now... So till the PowerPoint presentation is ready, we can have the Q&A session. Anyone has any questions to ask Dr. Ramesh, he's free, he can answer your questions. The question and answer session is on. No, they can come forward.
Okay. If there are any questions, yeah. Any questions, doubts, even suggestions, opinions, anything is welcome. Yes.
Duration, sir. Duration, நம்ம
Depends on the chronicity of the disease.
Okay, okay.
We are seeing milder lesions எல்லாம் very quick.
Okay, okay, okay.
Even doctor எல்லாம் சில கேஸுக்கெல்லாம் எக்ஸ்டர்னல்லே சேஞ்ச் வருது.
நல்லது.
But as we know, it's a systemic thing. We generally கூட கொடுக்கணும். Mild cases எல்லாம் 1 monthலே lesion ஒரு lesion ஆகும். Full body உள்ளதுல we generally say சோதனை பண்ணி இது பண்ணணும்.
Thank you.
So you're saying it depends on the chronicity of the disease and the Yes, use பண்ணலாம். Pregnant ladies can also take, even lactating women can take. பண்ணலாம். There is no problem. அந்த மாதிரி ஒரு பொட்டென்ஷியல் ப்ராப்ளம் இருக்கக்கூடிய எந்த ஹெர்ப்ஸும் கிடையாது. Very, very safe. Yeah, thank you. Hi, ready. Thank you.
എല്ലാവർക്കും നമസ്കാരം. Now I think time is 1 o'clock approaching. Everybody is feeling hunger. Normally, as an experienced teacher of 30 years, I know something teaching before the lunch and after lunch is very, very difficult. Before the lunch, everybody will be hungry, and hunger will make anger. And after lunch, everybody will feel sleepy. But I will make my best to make you not sleep and attend the class. Yes, welcome to my unique institution. And today's subject, yes, normally Mahatma Gandhi told, man should not be a slave of technology. We had to use technology as for our purpose. So we are more sophisticated with the technology. Even Ayurveda facing a threat. As I am very appreciate Dr. Ramesh because his experience and his research about the product as per in the modern point of view. This is contemporary we need, especially in Kerala. Kerala fight is going on with allopathy and Ayurveda. Allopathy telling the Ayurveda is not a science, we cannot believe it's a quack. So they want, we have to explain it their own words. Then only we will get to the universal acceptance. So that is we are in a era, we have to join along the movement. So what is psoriasis, Ayurvedic management story? Just some, I'm not detail telling, but psoriasis is a chronic, non-contagious autoimmune disease where the immune system causes skin cells to grow too quickly. This results in raised red or discolored patches covered with the silvery scales. While there is no cure, various treatments like topical cream, phototherapy, and medication can effectively manage the symptoms. This is the modern definition. Now, as per my experience, whether psoriasis is completely cured is asking several people questions. The disease is a lifestyle-induced skin problem, as per my experience. You can tell it autoimmune, but it is a lifestyle problem. We can manage, normally the question will come, sir, psoriasis can be treated by Ayurveda? My answer, no. We cannot treat psoriasis, but we can manage effectively and economically the patient suffering from psoriatic type disease with Ayurveda principles. That is my question. That is my answer. Yes, because nowadays, diagnosed psoriasis, confused management. Because when the patient comes, sir, I am suffering from psoriasis. Maybe they will come with some biopsy report also. Then they don't know, yes, Ayapala Karathaila. That's the only remedy. In Tamil Nadu, it will be 777 oil. So, what is the result of that? But our approach will be different, should be different. Actually, when a patient came to this symptom, first, Dogatnyanam. Dogatnyanam Medarit Nivaru Bishop Bhaves. First, we have to understand the disease, the total Nidana Pragruba Lakshana. So, for that, we have to apply the Pramana, Pratyaksha, Animana, Ubana, Aptavakyam. So, analyze the patient for a BAMS or MD student. Analyze the patient. We are seeing Behi Rukshada, Andasnigdada, and Rajakiranam, some white scales, reddish color, Pitta Pragriti, and by the analysis of the lifestyle, he has taken lot of Viruddhahara, and his Agni is not proper. Yes, by the signs and symptoms, we can analyze that is Vada Kabhaja Roga or Kabhavada Roga. How you are identifying? Yes. See, what is Charaka says, Rauksham Shoshatola Chulam Sangojanayama, Parucham Karavavo Harshachava Arunatamcha, Usteshu Vadalingam. You can see Raucham, Parucham, Shava Arunatam Vadalakshana here. Analyze clinically, you have to think the sloga from Charaga by heart. Then, Dahoraga Padisrava Baga, Visraganda, Kleda, Tadanga Badalam Chapitagra. Only slight Kleda you can see. So where Pitta is negligible. Again, Shaityam, Kandu Stylium, Ulseda Gaurava Sneha, Kusteshu, Kapajalingam. So by this, you can see more Vada and more Kabhalakshana. So your artist Vada Kapajaroga. So think, so this is Pratyaksha you have seen. And Anumana, yes, Vada Kabajara. What are the Vada Kapajaroga we are studying from Aptavakya? Charmega Gusta Gidva Sitma Alasa Vivadiga, Vada State Bodva, State Pitta, Dedrushadarushi. So here, the signs and symptoms of Pratyaksha Rashlani more related to Sitma Kushta, you can diagnose it as Sitma Kushta. What is Sitma? Sitma Ducham Bagis Nigda Anda Krishtam Rajakiraj, Sexual Person, Tanu, Sheda Ramram, Taudika Pushpa, Prayana Churdagaya Sian. You are identified the disease as a Sitma Kushta with Vada Kapajaroga. Again, the traditional way, as Charaga told, Bhudebhyo hi Paranjinda, Nasichinda, you have to think in the Bhaudika level. Bhaudika level, who people are not understand Ayurveda, it is the energy level. The basically one cell work can be kinetic energy, potential energy, mechanical energy in the mitochondrial vibration. That depends on cell's viability. When it is, this is the Vada Pitta Kapha, potential energy, kinetic energy, mechanical energy. Is a Vada Pitta Kapha. When it is altered, the vibration will, the cell will die. Or when the kinetic energy is more and more vibration will come. So here, again think of the Vada. What is Vada Kapaja? In the Bhavadika level. Vada means Agasha Vaibhyam Vayu, Atnaim Bitum, Amba Pradvibhyam Kapha. Here, Rasadadu will be less. And Vada means Vayu Buddha and Pradvi Buddha is more. So, in the Bhavadika Karana, basically you are thinking the Jala Buddha is less, Agni Buddha Vaishamyam is there, Vayu and Pradvi is increased. So, what is the treatment in the Bhavadika level? Here, we have to, as a clinical practice, how you approach clinical. We have to increase the Agni Jala Buddha in the body. And best choice, how? Which drug is Agni Jala Buddha, which can apply? The best choice is Girdam. So in this patient, as a traditional physician, I given Mahatitaka Girdam internally and externally. After a Kosta Virajana with Avipachi Churna and washing with salt water because he is a very, very poor patient. He cannot avoid the cost of the medicine. So I am forced to give simple medicine. So just to do Avipati Virajana 20 gram, then give Mahatikta Girdam internally and externally. Before externally, just to wash with the body with the salt water because to pradisarana, accumulated and this debris will be gone. If I have did this and within 2 weeks, this is the result. Ayurvedic clinical evidence-based clinical trial. What evidence is needed? So this is the basic approach. But now it is not my age, it is your era. So when Charagacharya's period is 300 BC onward, but now it is new gen era. So now we can see multifactorial etiological causes and multidimensional pathological manifestation in dermatology. So we want multi-level application of management methodology, targeting cleaning all the slaughterers, stimulating all the agnis, enhancing the organ functions, motivating the micro-level metabolism, aiming dosha samyam for tok prasadana. This is the basic of dermatological treatment in Ayurveda. Now, why I told you diagnosed psoriasis confused. These are the 4 patients of psoriatic diagnosed by the allopathy doctors as a psoriatic patient. But Ayurveda, we cannot say it is with the 4 patients is 4 types. The first one you can Vadagabaja. It is we can call it Charma Gushta, Asti Charmagara Sparsha. Second, it is Vadapaitya, you can call it Visarpa. This Pitta Kabaja, you can call it Ega Gushta. And the other one, Kabavada, you can call it Sitma Gushta. So the 4 patient diagnosed by the allopathy doctor says psoriasis is 4 diseases as per the Ayurveda, 4 condition, and the treatment will be also different. Now, because now the Parinam change, I told you when I am passed the VIMS 1980, we had no mobile, we had nothing. Now you are in the 2026, you are in the Gen Z. Parinama changed. Now the teaching also changed. Yes, now this is spreading all over the world by you. That's a technological era. So we have to adapt for contemporary importance. Yes. So just outlook. What is psoriasis in the modern version? Actually, it's a papulocomatous disorder, well defined as I think Ramesh clearly described, and remission relapse. I'm not going in detail. Now, morphology also usually dry, small, flat, and also my work half is done by Dr. Ramesh, and cause, exact cause is not known. Maybe genetic, maybe autoimmune, maybe environmental. The master switch is still a mystery to the modern world or medical science. Now, is it genetic? We can say relative 1/3 cases of psoriasis may be done. Maybe one of the patient 10% chance, both parents 30. These are the statistical, but not normally 700 crores of people. How to statistic with 1,000 or 200? What is we cannot take all the people statistics. It's a random sampling. We cannot believe fully. Just a sign. Now, yes, immune-related, autoimmune. As it's everything described interleukin by Dr. Ramesh. These are the modern, they are thinking, they are changing. Science will change always. Shastra will not change. That is the difference. Ayurveda is a Shastra. It will not change. Science is more. Science will change day by day. So they are thinking and that way, because they are not started from the basic. Ayurveda is started from the basic. That's the difference. Now, triggering factors that we can. Stress on, climatic change, medicine, lithium salt, beta blocker, chloroquine, cosmetic, trauma, infection, more prone in the dry skin people, and food and alcohol. Nowadays, lot of patients are coming with the COVID vaccine. COVID vaccine participating, I got 20 years back, I cleared completely. And after the COVID third vaccine, he developed full. So that's also new cause. Now, pathophysiology. There's an excessive turnover of the keratinocyte, dilation of coiling and superficial blood vessel, and leukocyte infiltration in the skin, mononuclear or papillodermal. Neutrophils in the stratum corneum, interfollicular epidermis is not affected. These are the pathology we can see. Next, the T lymphocyte migrate, release cytokine. All these are the one important one. Skin exfoliation within 2 to 3 days instead of 28 days. This is why it is 28 days. That is very important. All the physiological functions in the body come in 7 into 4 multiplication, because our body is like the cosmic energy. So that is 28 days. So diagnosis normally morphologically, erythema, induration, itching, and scaling. And hospital sign, Koebner's phenomena. Skin biopsy, parakeratosis, acanthosis, polymorphy in the epidermis, dilated tortuosity of capillary loops. Here, now, histopathology, that is very important. Normally in the psoriasis, the hyperkeratosis, marked thickening of the stratum corneum. Then diminished granular cell layer, elongation of the dermal papillae. Secondly, patchy infiltration of the dermis with the dilation of the capillary. That means, even though you are seeing dry lesion in the superficially, in the deeper it is soggy, it is watery. That is ulklasham. I want to clearly describe it in the pathology, Samprapti. Now, modern classification, several types they described the classification. I'm just seeing what are the classification. This is guttate psoriasis. In here we can call it Visarpa or Kidiba. This is plaque psoriasis. This is, you can call it Sigma. This is pustular psoriasis. This is yield diagnosis of Vicharchiga. So different condition. This is psoriatic vulgar. This is a Mahakushta. This is flexular psoriasis. You can call it Kachya. This is psoriasis of the penny. You can call it Ubadamsha, Vrishnagachu, etc. And this is palmar plantar psoriasis. You can call it Vibhadiya. This is psoriasis of the nail, Kunakam. Now this is scalp psoriasis. You can call it Dharanakam. Now, differential diagnosis. Actually, yes, different diagnosis. Actually, this one, it is tinea corporis and it is psoriasis. That is, it is a ringworm infection. There, it will be clear-cut round center, inert and active border with itching and small vesicles. And here there is no center, and it will be, itching will be very less in psoriasis, I think. And when we are studying, there is no itching in the psoriatic patient described. Now itching is more and more. This is differential diagnosis of tinea capita. That is, there is fungal infection of the, this is psoriasis of the patient, of the scalp psoriasis. This is eczema with psoriasis. When you are giving eczema, the medicine used in the psoriasis, it will increase. This is lichen planus and the psoriasis. It is kidibum and it is, you can call it silmum. Now this is, so what is our concept? Then, first I told you, Roga Jnanam. That means, Nidanam, Purva, Lakshana, Ubhay Samprapti, and Dosha Vaishvam, Paragari, and Shamanam or Shodhan treatment. So here, Charaka clearly written what is the etiology. Here, 2 points is very important. Shidoshna Langanaharam, Graham Bukta Nishavanam, Karmashama Bhayartanam, Drum Shidambu Sevinam, Ajirna Adeshanam, Navana Dedi Malsia Tila, Lavana Amra Nishavanam, Mashamulaga Vistana, Tila Chira Gudashinam. This one here, the Patya, the Ahara Vihara, Nityam Hida Ahara Vihara Sevi. Here, what is one button? Shidoshna Langanaharam, Graham Bukta Shevanam, Karmashama Bhayartanam, Drum Shidambu Sevinam. Here, nowadays, what is happening? You know, you are sitting in the AC. Now you are going out with 38 degrees centigrade. So that will cause some acclimation process in our body. Some interleukin, some peptide will be released. Then it is continuing. Gradually, the toxin will be released. That cause some immunological deficit. So that is the starting. It is not 1 or 2 days, okay. When it is continuing for 1 month or 1 year, gradually some problem will come. And then Navana Dedimal. Today is the fast food. All are this type of food. So today's lifestyle is very important to cause this disease. And clearly, what is Ashtanga Jatali? Midyahara Vihayana Vishesha Virodhina. Then this is Samprapti we can visualize. So what is happening, you know? Normally the homeostasis mechanism of our tissue. Normally, I told you, in the subtle level of the skin. Here, arterial and blood supply passing to the venous and interchanging of nutrition happening, remaining fluid will go into the lymphatic system, and this is normally it should be there, so that the interstitial fluid will be very, very pure and viable to the cell. When it is altered, the interstitial fluid will be impure, then cell viability will be, cell death will come. How? The arterial end depends upon the blood's purity. That purity of the blood supply depends upon your ahara and vihara. So what happens, you know? Here, when the rakta drushti, what is rakta drushti? the improper food habits. I told you, Navana Dadi Malsidira. And secondly, the two factors, that is brain over stress. The stress will not digest the food properly. Secondly, embryologically, the skin is developed. There are epidermis and dermis. Epidermis is developed from the ectoderm, from where the central nervous system is developed. Intestine is developed from the mesoderm, from where this dermis are developed. So the skin is very much related to the central nervous system and intestine. So that is aharam and intestines are two calls for the dermatology problem. So this here, when the blood is full impurity, let us think what is uric acid. It is impurity. Uric acid means when the body is not able to digest the urea properly, then it will increase. So if you are taking a lot of chicken, the chicken contains more protein. That protein should be digested properly, eliminated from the body. But when the excretory system is not properly working, or when the over accumulation of the protein in the body will cause a different attitude of the body, it cannot eliminate. So that will accumulate. Like even the cholesterol, even the fat, any toxins will accumulate in the blood. That is called the rectozostomy. Or we can call it inflammation of the skin. Sorry, inflammation of the blood. That is called amavastha of the blood. That is inflammation of the blood. That causes the dilatation of the artery. Due to that, the proper exchange of nutrition and fluid will not happen, and the lymphatic system, venous, everything will be swollen due to the impurity. So the viability of the skin is not proper. The skin will be damaging and death will happen. By that, gradually it go upwards, the skin will be damaged. So here, what happens in psoriasis, the disturbance of the force of the skin, that is intraepidermal coherence and dermoepidermal adherence. These two forces maintaining the skin nature as such. So this will be altered. That is the cause of the basic cause of the dermatology problem. Here's a contemporary concept of the psoriatic. Here, formation of the endotoxins or AMM and the release of the free radicals, increase in the body temperature. That's our. The temperature will be increased in the blood. Then decrease in sweating, hypothalamus disturbance, defect in the temperature regulation. Because due to the severe stress, the hypothalamus is altered, the temperature regulation mechanism is altered. Psoriasis, there is no over sweating, and the body will be heated. So this cause. Then it altered the force and the coagulation of the arteries, increased proliferation of the cell, cause exfoliation. Then psychological stress affect the hormonal status, release of adrenaline, increase the body heat, effect on the hypothalamus. As per Ayurveda, it is called aphatya, ahara, vihara, and manasika, cause raktadushti, raktavaha, srododushti, sadhushidhala, dosha, dadumula, samurshana, and koshanasham, causes tukki vikalanam. This is the samprapti of Ayurveda of this psoriasis patient. Now, so our approach, treatment, classic Uttarishta treatment. And it is Adakavara, Dosha Shamana, incorporation of Dushivisha, psychological aspect, Patyahara Vihara, Nidana Ayurvedam is very important. They have to keep the lifestyle total change. It's not easy, but and Samprapti Vikatram and Ukpriya. Nidana Ayurvedam is very important. And Samprapti Vikatram is the Shodhana Chikitsa. As Ramesh, it is not easy to for all. So, Ruk Pratikriya means Shamana Chikitsa. When the patient is coming with severe itching, we should reduce the itching, otherwise the patient will go to another patient. So Shamana Chikitsa is very important. Ruk Pratikriya should be there. That is very important nowadays. Due to the high-tech lifestyle, it is not easy to spare 2 weeks in the hospital. But if it is emergency, they will do. Now, treatment principle. I told you, embryology, we have to do both psychological treatment and physical treatment. And there, Shodhana and Shamana should be there. Shodhana is very important because I told you the pathological changes. Here, we have to do Srodo Vishodhana for clearing the channels. Medo Vilayana liquefy the stagnated fluid. And Kabasravanam, remove the accumulated fluid. And Malashodram, eliminate the endotoxin. And in Ayurveda, this Prasadana karma is doing by Shodhana therapy. Here, actually what I mean, if you are, here this importance is Panchakarma. If you are doing some Raktamoksha from the vein, that will create a negative pressure in the vein. That will absorb the accumulated fluid and toxin to the veins. So the metabolism will start. Not only Raktamoksha, even Vamana, we are doing Virajana. But it Virajana, here lot of water is drawn. So that will cause them negative pressure in the vascular pool. That cause the auto-purification of the body. That is happening by Virajana or the Vamana or any other Panchakarma therapy. Sure. Now, the management principles, I told you Srodha Chodhana and Dosha Chamra. For relieving the symptom, reducing the inflammation, restore the circulation, clear the metabolic channel. And the prognosis depends on severity and chronicity. Here we have to consider Vyana Vayu and Brajaka Pitta. Yes, Shodhana is very important. I'm not going detail. Here, Vamana Virajana, Vastidasya, Raktamoksha, and specific treatment of Kerala Panchama, that is Takradara. This for stimulating the brain, etc., for stress relief. And Snekhabana Sedana is very, very important, especially Snekhabana. So, what is important of Shodhana? Panchakarma doctors, please listen. Actually, Shodhana is the biopurification therapy. That is two types, transmembranous purification and transcutaneous purification. This is done by Snekhabana and Sedana. It stimulates these two types. Secondly, transenteral purification therapy by Pradhana Karma, Vamana and Virajana. And systemic purification by Raktamoksha. These are the purification therapy of the body, 5 types. Now, so when Snehana is introduced, Snekhabana is very important, especially for psoriasis. Nowadays, the several doctors are doing other treatment, except Snekhabana. Even Takradara they will do, but not Snekhabana. Snekhabana should be first. When Snehana is introduced, it may improve the complexing of the waste and make easy for exocytosis. Since the cell membranes have made up of lipoprotein, and it facilitates the diffusion through the biological membranes and can cross the barrier which is the thickened cytoplasm. So, in the body, when the urethra is more, the lipoprotein fraction will be less, lipids molecules very less. So, Snekhabana improve the lipoprotein function and the exchange of the fluid and nutrition will be very easy. That is effect of Snekhabana. So, important of Snekhabana, Shodhana acts through the systemic channel. Purvakarma, Snehana and Sedana acts through the biomembranes. It stimulates the diffusion process. And it fulfills the effect of Shodhana process. It has both curative and preventive aspect. Then Snehana is more important. This is one of the important of Snekhabana. I told you psoriatic vulgaris. We did Snekhabana, and after Snekhabana we did some Swedana and Virajana within 10 days. This is the result. So, Shodhana therapy, that is Snekhabana, is very important. This is palmar plantar psoriasis after the Shodhana. This is actually, we cannot diagnose it as a psoriasis. The allopathy doctor diagnosed, but actually it is a lichen planus. And this patient from Calicut, one Vaidyan give Ayapala, then it is increased. And his IG is 2500, lymphocyte is 60, and neutrophils are 40. So some allergic process is here. Now, Shamana. Now I told you Shamana, Yuk Pratikriya is very important. And Shamana is started when our age, we are making the Kashaya, prescribing Kashaya, and the patient should prepare. Now we have prepared medicine, and now, yes, or a tablet. Now recently ointment, all that changed. As Dr. Ramesh told, it is not easy to drink Kashaya more. Nobody is interested to take Abhinga. But we have to change, but quality should not be altered. There is no compromise the quality, but palatability, yogyam aushadam should be there. So here, Shamana. Shamana Chikitsa medicine will be Agni Debana, Dosha Shamana, Srodha Vishodhana, Rakta Shodhana, and Mutrala, Malashodhana, Yagrit Samrakshana. Because it is Rakta Dushti, Rakta is coming from Yagrit Plihano Prapya Pagaragu Bede. So this quality, or we can metabolic improvement, liver protective diet, all our medicine are like it is. If you are giving Parola Gondadi Gasham, it is diuretic, it is Shodhana, the body will be clean. So these are the principles of medicine. Now what are the medicine available? You can select as per the dosha. You can Parola Gadruniadi, Guluchiadi, Aragodadi, Mahatikta, Tiktaga, Punarnavadi, lot of medicine you can use. Here, one of the important, Villadi, Dushishadi Gulia, Kaishare Gulu. Nowadays, Haridra Gandam is very good for itching. It's anti-allergic. Nowadays, more allergic disease, autoimmune disease increasing, Haridra Gandam is very important. Then Aragavardhani, Annaveri, Lochvaspam, and Gandhagarasanam also very useful in this exfoliative dermatitis. Now, externally, Eladigaram, Lakshadi, Parandiadi, Panjavalkadi, Yuvatyadi, then Jivandyadi, Dineshavaldyadi, Ayyapalakar, that is a trump of Ayurveda doctors in psoriasis. But, right here, Tindoria. But, I told you, whatever it may be, Doshasya yasya pasyas kushteshu visheshalangumedrakam tasyeva shamananguja adapparanjanamandasya. Identify the dosha. Now, this is patient, I told you, it is Vadapaitija. Here, Shamana prescription, you can consider it is a Visarpa, and the dosha is Vadapaitija. There are two protocols you can apply. First protocol, you can give Manjushtadi Kashayam, Tribala Gulglu, Villadi Chandraprabha, Navai Sangulia, Yuvatyadi, and Panjavakadi Kerala you can apply. Second protocol, because if you can pay, here, first you do a Virajana with Adipati 20 gram and give some Gridam. Especially here you can give Tiktaga Gridam. And Pradisarnam and Labranam. Pradisarnam, I told you, just to wash the body with Uluchiyadi Kashayam. And apply, here you can apply this Mahatikta Gridam you can apply. So if you are, I selected the second one. So within 2 weeks you will get the result. So dosha is very important. Now this is Eka Kushta. Here Pitta Kapha dosha. Here you can give Guluchari Kasham, entirely different medicine. Psoriatic patient diagnosed the allopathy doctor, but Ayurveda is not considered psoriasis. And Gandhagara sign you can give Dushi Vishadi Guliya and the Chalanam with Varakashayam and apply Mahatiktaga Gradam. If you are applying, we can 2 weeks or 3 weeks, you can get this type of result. This is the treatment, simple treatment. Now, Sidma, this you can diagnose the Sidma. He's an MBBS student from Calicut Medical College. And Kabavadam and slight itching and scaling is there. Here, Aragadadi Kashayam, Villadi Gulja, Mahatikta with the Vaisam Gulja, and here you can apply Ayapala Kerdaida. And if you are applying, you can get this type of result. Now, this is pustular psoriasis. It is Pitta Kabaja. Here, itching is oozing, slightly sticky, appearing slight fever and pain. Here, Guluchiadi with Tribala Gulgulu, Arogyavadri with Villadi, Tribala Kashaya, Chalana with Mahatikta externally. It is pustular. Pus is the inflammation, that is Arogyavadri here. Here you can get this type of result within 2 weeks. Ayurveda, you get immediate result. Don't, some thought, Ayurveda you taking once, 1 month or 2 months. No, within 2 weeks you can get the result. If you are giving proper medicine, the proper dose in the proper condition. Act medicine. And here, now, use of Ayyapala. So, Ayyapala actually it's a jaundice curing drug and used in the treat pain. It is an anti-inflammatory analgesic in keratolytic action. What is kerato? It is keratolysis. So, the thick scale will be lysing and it will go. That is coming under Kudaja variety. It is called Sheda Kudaja. So, why I am telling this? I have history. This patient coming under in the COVID period is coming from Malapada. Actually, he developed this lesion. And after this lesion, he, Alappuzha Medical College, he approached that. They did the biopsy and got morphology features favor guttate or eruptive psoriasis. Correlate clinically. Psoriasis, then we can approach Ayurveda. Okay, then due to the COVID, the patient was not able to go out. Just approach the Ayurvedic doctor. Immediately, psoriasis, we have effective medicine. Come. And the doctor given Ayyapala Keratailam and this type of exacerbation happened. Ayyapala, within 2 days. And so they approached online consultation to me. So what happened, what is Ayyapala? It is, that is, Kudajitta Kashayana, Kaduditta Kabavaha, Divana Padane Vrishya Grahani Raktashodhe. But here, Asya Patram Kadu Ushnam Cha Kabhavada Vinashanam. Ayyapala is preparing the leaf by Aditya Pagdaila. It is Kadu Ushnam. The Ushna will increase Pitta, as Ramesh told. So, why it is increase, you told him? The patient, when I am actually Ayyapala is in contraindicated Pitta Pradhana, Pitta Nibandha condition, and also in the eczematous seborrheic atopic dermatitis. So the patient, when analyzed, having itching and scaling, history of atopic dermatitis, he is engineering or this architecture student. His food habit, 3 days paratha and chicken. And he's work total night, no sleep at night. That is, he's studying architecture course because I told night he has to do some work. So night no sleep, daily 3 times paratha and chicken. Then his ESR and IG is 3000, ESR is 90, and he's a typically Pitta Prakriti. So, and Kava Pitta Dosha, Gara Nidana. So in this condition, when you are applying Ayyapala, it will increase. So here we are given Haridra Gandham Doshi Vishari, Lodra Sevyadi Chalanam, and Mahatikta Girdam action. Some doctors say, how this Girda is actionally applied? Huh? I have got experience. I given this Mahatikta Girdam to our patient. Here get a good result. And one time he went to an Ayurveda agency to purchase this Girdam. Sir, Girdam is actionally. No, it is wrong. The doctor had wrong. And that BM doctor will make it in Mahatikta Labam. He applied, the whole body is inflamed. So that is happening in the clinical practice. He just entered BMS. So he know only Mahatikta is only for India, not actionally. That happened. So here, in this patient, yes, now after the 2 weeks, the patient was very much good. And I told, don't take any non-veg, only fruits, and night you have to sleep. So this, I told you what is Ayyapala is happening. And here, another thing. This is patient, some itching all over the body. And it was chronic. He's consulted several Ayurveda doctors, 1 or 2 allopathy doctors, and they did 2 times or 3 times biopsy. And the biopsy here. Biopsy report. Yes, this was the biopsy report. That means skin biopsy is subacute spongiortic dermatitis and psoriasis from dermatitis. With a spongiortic and dermal edema, features compatible to eczema. Second, the features also induce change of background psoriasis from dermatitis. So one allopathy doctor, several, even he had given steroid, and then also he applied this. So this one special sorafon oil. Allopathy doctor prescribing Ayurveda medicine. But they are against Ayurveda. And after applying, immediately the patient become allergy like this. And the medicine is sorified. It's called Rhitia tindoria and Azaraka indarya. And he has very pathetic condition. So what is Ayyapala? Ayyapala will irritate in Pitta Pradhana and Pitta Nibandha condition, especially in the eczematous and seborrheic dermatitis, because it is Kadushna. Then, so in such conditions, apply, think about the doshavastha. You can mix with Nalpamaradi in Pitta Nibandha or Pitta Prakriti. And you can mix Dineshavalyadi in Pitta Nibandha conditions. Third, Vadadiga and Lakshadi with Ayapalagada. So I still remember, actually this is my idea. So how Dr. Ramesh got this idea? Yeah? Yes. No, that is why, because it is the scientific thought. We were thinking at like that. Even my family, അച്ഛനത് പറഞ്ഞു കൊടുത്തിട്ടുണ്ടോ ചോദിച്ചതാണ്. These are our special idea, special application. Because these are the scientific thoughts of our Acharya. Chargas all are thinking in that way. So the basic Ayurvedic principle is concrete. If you are thorough with that, your path will be very, very scientific. So this is the Ayyapala. Here, yes. Ayyapala actually, Dineshwali actually is a Vembala, Vetpala. Actually, it is the most important discussion coming on Valavisarpa. Arogya Kalpadrimam. Actually, it is Pitta Shamana, Pitta Kaba Shamana, and it is Kashaya Tekterasa. It is used in the Visarpa, Varnya. So here, Pitta Kaba Shamana also. So when you are adding this initially with this Ayyapala, it will cause the Pitta Shamana also. That idea Ramesh made into practical from his father's thought. That is very good. Now, so this is treatment complication. Ayyapala with Dineshavalyadi result. As the patient from, actually this is a small 12 years old child from Tamil Nadu came to me. And Ayyapala we are not able to give as such. Then this is Pittagabanivanda. Here with again with Dineshavalyadi result. This patient also from Tamil Nadu. I think Tamil Nadu Soviet patients are more, I think. Yeah? Maybe the food habits. This is with the more dryness. Here mixed with the Lakshadi Kerala. Result is evidence. Yes. Now Soravin. Actually, maybe 1 month before, Ramesh told that he had there's some new launching of the medicine with this Soravin and the tablet. So he invited me for a talk, and he told that I will give some sample also. And his marketing team given me some ointment and this tablet. And at that time, fortunately, 2 patients are admitted. And I applied this Soravin to patient. 3 days application, the patient resulted this one. Soravin. This patient will little bit Pitta Prakriti. Within 3 days, Soravin got result. So it is scientific. This another. And this is very important. But this patient, actually, I told you this patient, 20 years back I treated, sorry, and after the vaccine, he precipitated. And every year, when he did any other work in the heat allergy will come. And he again, maybe you can see the lesion here. Again, it's Soravin applied. See the result. I congratulate Dr. Ramesh for implementing a very simple medicine. Because otherwise we have to mix the, and